This presentation will discuss the pathophysiology of stress and how each body system is affected individually. We will then discuss substance abuse and then combine the two to look at the impact of stress on that disease process. So what is stress? The term stress refers to the process involving perception and response to harmful, threatening, or challenging events or stimuli. Each individual will process stressors, whatever those might be, differently and may have different reactions to different types of stress. Stress experiences can be emotionally or physiologically challenging and activate the stress responses and an adaptive process to regain homeostasis. So let's first look at the immune system's response to stress. When stress occurs, the body proceeds to increase the release of adrenal hormones, such as adrenaline and the production of T lymphocytes. T lymphocytes are important because it's one of the main body defenses against viruses, bacteria, fungi, and cancer cells. Prolonged stress weakens this response and the T lymphocytes become suppressed. Prolonged stress weakens the immune system as a whole and will also cause delayed healing of wounds and increased susceptibility to other disease and health-related issues. The brain is obviously the key organ in stress response. Its job is to determine what is and what is not threatening and what is potentially stressful. It also, because it interprets the stress, it interprets how the body reacts to the stress. Over time, stress can cause disruptions in neurotransmitter metabolism, neuroendocrine function, and synaptic plasticity, so it truly affects your neurons down to a molecular level. When an individual faces stressors or some form of threat, the hypothalamus starts to release two chemicals, vasopressin and corticotropin-releasing hormone, or CRH. These stimulate the pituitary glands to release ACTH, which then turns into cortisol. When the body releases cortisol, it helps controls the body's metabolism of fats, carbs, and proteins, as well as regulates heart rate and blood pressure. The ACTH travels through the bloodstream to the adrenal glands, and the outer layer of the adrenal glands in the cortex, it then is stimulated to release corticoids, which help the body increase its energy levels, energy stores, and raises things like heart rate and blood pressure. Through the cascade of reaction, cortisol causes the neurons to accept more calcium channels through their membrane. So the neurons become completely overloaded with calcium and excitable. So this causes increased firing signals to the brain. It literally excites the brain cells to death. So it overloads the body's reactions and causes the brain cells to be hyper excited. That's why when you're stressed, things happen like sweating, elevated heart rate, tremors. This can also lead to brain cell death, and previous studies showed that as adults we do not regenerate neurons. They found this isn't necessarily true, it just happens in very specific areas of the brain. So even prolonged day-to-day stress can lead to changes in the brain function and changes in the neurons in the brain. Over time, these make people more vulnerable to mental illness as well as social disorders ranging anywhere from depression, addictive behaviors, and anxiety. Cardiac response to stress. So as the body feels stressed, the heart rate increases. It increases the force at which blood is pumped throughout the body, so cardiac output is increased. Because of this elevated cardiac output and this high pressure that's now going through the blood vessels and arteries and veins, blood vessels become damaged, coagulation increases, platelets increase, and there is an increase of fatty deposits along the artery lines. And this can lead to atherosclerosis, heart disease, increased risk for heart attack, and blood pressure also rises. Gastrointestinal stress response. So when the body's feeling stressed, it starts to prioritize. The GI system is one of the first things that the body says, okay, we don't need to be sending blood here right now. We need to prioritize and send it out to the muscles. So blood is diverted from the gut out into the muscles to prepare for a fight or flight situation. That means peristalsis is reduced, the sphincters close, and there is a release of acidic juices that helps with digestion is all decreased. So in turn, the intestinal tone decreases because there's not all that blood flow, digestion slows down, and over time, these things can lead to chronic constipation, stomach acid dysfunction, and the development of stomach ulcers. So now with all of that knowledge about how stress affects each body system and mind, let's move on and look at substance abuse. According to the ICD-10 and DSM-5, substance abuse disorders are characterized by psychosocial, behavioral, and physical symptoms which include perceived loss of control of use of substances. It also includes craving, difficulty fulfilling sanctioned roles. Substance abuse is also characterized by the continued risky substance use even in hazardous situations and the manifestation of physiological dependence. So behavioral indications for substance abuse are the substance is used in larger amounts over longer periods of time than initially intended. Nobody sets out to become addicted to a substance. So let's say a person is having 1 glass of wine a night with dinner every day. That turns into 1.5, 2 glasses, and over a period of time can turn into an excessive issue where a person is having multiple drinks a night. There is a persistent desire and unsuccessful effort to cut down. So this person may start to crave the substance more and be unsuccessful in stopping to decrease their use. There is a lot of time spent obtaining, using, and recovering from said substances. Substances will also result in a failure to fulfill different role obligations. This can include not doing schoolwork, not showing up to work on time, or performing work roles efficiently, affect family structures such as parenting. There's also a continued use despite persistent and recurrent substance-related issues. As we just said, people with substance-related issues may not be fulfilling their job roles. They may lose their jobs, but despite these sort of negative impacts that these substances are having on their life, they're going to continue to use these substances. They also will continue to use substances in recurring risky situations. So they may be endangering themselves, others, such as drinking and driving. Okay, well, I didn't get a DUI this time. So it was okay last time, I'll try again, even though they may be putting themselves and other people at a huge risk. They also have issues reducing or stopping important social, occupational, and recreational activities. So these people who once enjoyed their jobs or playing sports may no longer do these things because the substance will start to take over and become more important. So as a nurse practitioner, what are things that you're going to look for? What are different implications that you can use for your bedside practice?
I would say first and foremost, know the symptoms. So some 4 biggest categories that you're going to run into are alcohol, opioids, stimulant, and cannabis. So the symptoms of alcohol use are slurred speech, coordination issues, impaired attention and memory, unsteady gait. In my personal practice, I've noticed a lot of patients with significant alcohol abuse histories will have random bruising or small injuries that they don't really know where they came from. A lot of times these are from a fall they may have had while they were intoxicated. Opioid use includes also slurred speech, drowsiness, and constricted pupils. Stimulants, these patients may have irregular heartbeats, pupillary dilation, weight loss, muscular weakness, seizures, and confusion. Whereas cannabis, these patients will be tachycardic, have a dry mouth, hypertension, and they may have chronic issues such as bronchitis, sinusitis, and cough because this is generally an inhaled substance. So as a nurse practitioner, now that you know the symptoms to look for, you need to monitor your patients. So with your patient who has chronic substance abuse issues, are they having organ damage from these long-standing issues?
So you're a patient with a huge history of alcohol abuse. Are they having liver failure? Are their liver enzymes, bilirubin, are they elevated? You may need to do some more lab work, CAT scans to evaluate their internal organs, and just be aware that they can have significant organ damage from long-term substance abuse. You also need to monitor for the signs and symptoms of withdrawal. So for opioids, patients will have a dysphoric mood, muscle aches, pupillary dilation, sweating, diarrhea, agitation. Stimulants, any symptom they have from taking stimulants, the withdrawal will be the opposite. So they're generally fatigued with a depressed mood, increased appetite, and agitated. For cannabis, interestingly, repetitive yawning is a symptom. Fatigue, anxiety, depression, irritability, restlessness, small tremors, diaphoresis, abdominal pain. And then there's alcohol withdrawal. Interestingly, alcohol withdrawal is one of the most physiologically damaging types of withdrawal a patient can go through. As we spoke about in earlier slides, when the neurons are like hyper excited by stress, it can cause severe damage. So with patients who abuse alcohol, their body is so used to having some baseline level of alcohol in their system, and alcohol is a depressant. So the neurons get used to firing at sort of this lower rate. And then you take away that stimulant, which stresses the body, and the neurons all become hyper excited, and they become, as we said in earlier slides, they can literally excite themselves to death. So these patients who have alcohol withdrawal are going to have tachycardia, hypertension, sweating, nausea, vomiting. All of the GI processes are now sped up because everything is in the body so used to sort of being at this slowed down rate. These patients can have generalized like tonic-clonic seizures, audible and tactile hallucinations. So really, patients with alcohol withdrawal need to be very closely monitored, and they may need to be monitored in a hospital setting for their safety, just to make sure that they safely get through withdrawal. And a lot of times they can't be monitored appropriately in an outpatient type of setting if their alcohol abuse is severe enough. So to go hand in hand with that, does the patient need treatment? Do they need inpatient or outpatient counseling? Do they need to do they need to go to a rehab type of facility? And are there other mental health symptoms? So is the patient having depression and anxiety? Many times substance abuse sort of goes hand in hand with other mental health symptoms. So especially if a patient has let's say depression and alcohol abuse, they will need to go to a specific treatment facility, such as a dual diagnosis facility, which treats both things and not just the substance abuse disorder. As a family nurse practitioner, this may be the time where you need to call in your behavioral health colleagues, get suggestions, refer the patient out for additional services. So now let's bring it all together. We've discussed stress and how that physiologically affects the body. We've discussed substance abuse and the body's reaction to that. Now let's look at the way that stress affects patients who have substance abuse issues. So the first study we're going to look at was done by Sina in 2009, and this was more of a meta-analysis that looked at existing studies that were done on patients with current substance abuse issues who were seeking treatment. So in these studies, patients all had PET scans at multiple times during multiple different scenarios. So the patient was talked through different scenarios using guided imagery that would elicit different feelings. So anxiety, fear, sadness, happiness, and then there was a PET scan done to show what their brain looked like when different feelings were happening. So they found a positive correlation between drug-induced cravings and stress. In contrast, non-addicted persons in the study did not have the same maladaptive brain reactions to stressors and to stressful discussed situations as the patients who had existing addiction issues. So she concludes that stress exposure and chronic distress decreases the adaptive coping mechanisms in the brain and can lead to increased substance abuse. The second study we're going to look at was done by Fox et al., and he performed a study to assess the correlation between the frequency of cocaine and alcohol.
Alcohol abuse and exposure to stress and drug-related cues. So this study took 45 recently abstinent treatment-seeking cocaine abusers who were either categorized into high and low frequency users based on the last time they used cocaine. So next, the participants were all exposed to 5-minute increments of guided imagery that involved a personal stressful situation, a personal drug-related situation, and then a neutral relaxing situation. These were all done in different sessions on separate days and presented in a random order. So through studying both subjective and objective factors, such as the patient's reported stress levels, and then they also looked at vital signs and lab values, specifically cortisol levels. So they found that these cortisol levels were increased when the patients were talking about a stressful situation, and there was also an increased drug craving response that appeared to be similar to having the effects of cocaine. So as we spoke about very early in the slides, an increased cortisol level is a body's reaction to stress naturally. The third study, similarly to the other one, was done by Burnquist et al., and it took 20 treatment-seeking alcohol-dependent patients that were exposed to 3 different scenarios. All included guided imagery of a personal situation, an alcohol-related situation, and then a neutral situation. The patient then reported back their alcohol craving, anxiety, and emotional scale during these different situations. Next, their cardiovascular measures were taken, so how was their heart rate and blood pressure, and then they actually did a salivary cortisol level. So they soaked a sponge in the mouth and sent it off to have their cortisol level tested. This data all showed that increased stress, specifically surrounding the alcohol discussed scenario, increased the desire for alcohol physically due to increased cortisol levels, and emotionally, they reported increased anxiety. This study, however, did have a limitation of lacked a healthy control group. Thank you for sitting with us through this presentation. As we saw that stress truly affects the body systemically in every system. Down to the molecular level. We also saw that substance abuse can be significantly impacted by long-term stress. And thank you for joining us.